Okay. Another little housekeeping before we get started. I know it can be tricky when you're trying to figure out where to go for help with your child. So just to clear that up a little bit, if you have student specific questions, something very specific about your child that you need an answer to, you would go to the team at your child's school, right? If you need support in finding community resources like an after school program, a tutor, something like outside counseling services, anything like that, you would still refer to your school team. Okay. And then they can also direct you to NYCPS centralized support if they can't help you from there. On our part, our role at NYU, aside from these family workshops, we really don't interact with families at all directly. So unfortunately, if you were to send a question over to us, we would still have to direct you back to your school. So our role really is to provide consultation and support to the teachers, the principals, and all the providers that are serving the children in the schools. Okay. Our objectives for today. We hope by the end of tonight, you understand ways disclosure of diagnosis can be helpful for an individual. We want you to be able to identify strategies for sharing a diagnosis. And we're going to review some common questions and concerns around disclosure. Our agenda for tonight, we'll go over why would you disclose, right? The NEST program and disclosure, how those two kind of mesh. Some strategies on disclosing. We'll go over some common questions and concerns. And then at the end, we'll have a share out, and then we'll be able to answer some of those lingering questions that you may have.
And someone put in the Q&A a really good point about disclosure, asking if kind of what aspects we're focusing on. And so tonight we're really going to focus on talking to your child or the NEST student that you are caring for about their diagnosis. There is also a part of disclosure around like self-disclosure and when a student chooses to talk to others in their lives or to share with the community. We are not going to focus on that as much, but if we have time at the end, I'm happy to also answer some questions about that piece.
Thanks, Michelle. Okay. Another note before we jump right in. So yes, at NEST, we do a lot of the research on our end. And yes, we do the training and all the consultation in this field, but you are the expert because it's your child, right? So trust your instincts and speak up, advocate for your child's needs. Okay, because you are the expert. Okay, now we're going to jump right in. Why disclose? Take it away, Michelle.
Of course. So we wanted to start by really just grounding everyone and why are we talking about this and why can it be so helpful and powerful for a student to know that they are autistic? So when we think about it, looking at the literature from self-advocates, for example, one of the things that we know is that families being open about an autism diagnosis can really help the individual build self-awareness, really help them understand what they need, and build in opportunities for advocacy, really help a student understand kind of the hope, right, is that school is providing them with what they need, but also as they get older and in their life that they're able to advocate for what they need. It also can actually reduce anxiety about differences. This is something self-advocates talk about often, is that they can become aware that the way that they are perceiving the social world, the things that they need are different than students around them. And sometimes when you don't have a name for that, it can actually be scarier, right? Because I think sometimes we can, in our brains, can come up with alternative explanations. And so many talk about actually having some reduction in anxiety to know, oh, there is a name that goes with this experience. There are other people who have similar potentially experiences to me as well. I think another advantage, and I think the beautiful thing about NEST, for example, and everyone here tonight, right, is that it connects to a community. I think that this, something often parents, if your child is diagnosed quite young, often the first step as parents are connecting with other parents and feeling that sense of community. But I think our autistic individuals can also feel that as well. And sometimes knowing about their diagnosis can help them find that community if that's something they're interested in and if that's something they connect around. And so I think feeling that connection can often be really powerful. Families being open about diagnosis can actually improve self-esteem. I think this is one of the most common, often a common question that we'll talk about later is concerns that it's going to lower a child's self-esteem. And actually, I think that what we find is that it can actually be empowering for individuals, and it can kind of shift this narrative from maybe thinking or wondering, like, is something wrong with me? Why is this harder for me? To really understand and empower them and to know their strengths as well. Families being open about diagnosis can also reduce stigma and shame around the diagnosis. I think, sometimes the things we don't talk about, by not talking about them, by keeping it kind of secret inadvertently, right? For like our older kids, for example, it can kind of send a message that there is something wrong. And so talking about it and being open about it models for our students that this is part of the neurodiversity spectrum, which we'll talk about in a little bit as well. And also really can help build trust in you as the caregiver. I think having that shared experience can be really important. I think one of the things I often think about for students is that, they're going to potentially like therapies. They're getting pulled from school. And I think that, or pulled from classes potentially, right? And noticing that they're getting these different supports. And I think for any of us, right, what would it be like if you were going to the doctor once a week and you didn't know why? And so I think this also really can be foundational, these conversations, and these caregivers having these conversations can really build that trust and connection with the individual you're caring for as well. And I see a question in the chat about why shouldn't school disclose the diagnosis to students? So we're actually going to talk about that in a little bit about the Nest law. But I do see, correct, like HIPAA laws, because I think this just went to hosts and panelists, but someone replied that school providers are not allowed to disclose the diagnosis, certainly without a parent's explicit permission. And we'll talk actually a little bit more about how in general, we really want to support parents in having these conversations with the child or the individual directly. But first we're going to play this video. I know, Rani, you were going to introduce.
Yes.
Yeah.
It's a great video. We don't get, so everything we do at Nest, we try to get from the self-advocate, we get set up self-advocate input. Sorry, I am tired. But I like this video because we get it from a younger side too. Usually when we get self-advocate videos, they're on the middle school, high school level. So this is nice to see an elementary version. But just a note before I play this one, you're going to hear them touch on the topic of medication. And while it is common for autistics to have comorbidities like ADHD, that is not always the case. And even if it is, medication is not always warranted, right? So it's all on a case-by-case basis. And I just wanted to give you that info before we get started.
When somebody meets you for the first time, what do you hope they think?
That I'm not real. If they think I'm real, they're not gonna want to be my friend. I love to have friends.
What were the earliest signals that there might be something unique about Ryan?
He was nonverbal till he was 4. I see myself as the person that doesn't really like to talk and that doesn't really know how to make friends.
Tell me about the moment you told Ryan his diagnosis.
It was something happened in class. I believe it was in the third grade. And he was like, I'm just different from everyone else. And then that's when I told him.
What kind of person are you?
Unique.
What makes you unique?
I'm autistic.
What did you think when your mom told you that you're autistic?
I thought she was tripping. Because I really didn't know what that meant. So I thought she was just making something up.
Are you happy your mom told you that you're autistic?
Yeah.
Why?
So I can know why I was spelling the odd ones out. I just wrote the odd ones out. Like in the class, if we do a project, you know, in a group, like it's hard to not think about what they're thinking of you.
What was it like for you to hear Ryan describe himself as the odd one out? It hurt my feelings. It did, like, yeah, I don't know, it stung. Because I was like, nah, you know, like, defensive immediately. What did your mom say autism meant?
That you're smarter than average people.
After she said that, did you still think she was tripping?
Yeah,
Why?
because I didn't really think I was smart. I'm Ryan's sister, and I'm diagnosed with bipolar disorder, anxiety, and depression.
What's it like to be diagnosed with those three?
It's kind of hard because I'm not like, you can't really see anything on the outside, but on the inside, it's like I'm struggling pretty much every day with normal things, especially with helping my brother, because I'll go into like a depressive state and he wants to do this, and that, and I can't because I'm like, want to be by myself.
Do you and your sister get along?
No.
He is too blunt.
Do you like your sister's hair?
Yeah. It was pooping out the green. I think she's going for the joke.
What did you think when your mom told you that Ryan's autistic?
I'm like, what is that? And she had to explain it to me. I'm like, is he gonna be okay? And she was like, oh, he's gonna be fine. She was just like, he's gonna be really different to be in for classes, but he's like really smart. And I was like, that's cool.
Does autism come with any challenges?
Yeah. Anger. When you get angry at certain stuff.
He'll cry, or he'll slam the door. He'll start like throwing things, but it's not his fault. I know it's not. So like, I don't get mad at him about it. I used to, because I didn't know what he was doing. I just thought he was being annoying.
What kind of things make you angry?
Not understanding it and having to get off something if I'm even though I'm in the middle of it. And especially when I take this medicine that makes me focus. And then when I have to get off the game, I think about it all night. So that makes me barely get sleep.
So you can't get sleep because you're thinking about the game?
Yeah.
What does the medicine help you with?
Focusing on things like my chores.
So it's good for focus, but it can also make you too focused?
Yeah.
What's that like?
Pretty annoying. Especially when I'm very tired, even though I really can't go to sleep because I'm thinking of it. And then I start to think of other things, and then I just don't get sleep at all.
When somebody meets your son for the first time, what do you want them to know?
That he is not being rude. He gets that a lot because they'll either try to talk to him and he's just not a talkative person. Or try to shake his hand or touch him. He's like, no. That he's just not that person. You have to come, let him warm up to you or to any situation, let him warm up to you. And then he'll be your best friend.
If somebody wants to be your friend, what should they do?
Honestly, I'll just say they can be my friend. They really don't have to do anything. Unless, like, if you want to be my best friend, it's gonna take like 2 years.
If somebody wants to be one of your best friends, what should they do?
They should have to stick by me for a long time, and we both have to defend each other.
How little? My mom can't even tell you. I used to call him my child, like he was my kid. And so like I see him as like my kid, and I don't want anyone to mess with him or hurt him or anything. So basically, I watch over him, and it's kind of scary when he gets new friends. The club scared they're going to judge him.
If you had to describe your sister, what would you say?
Overprotective.
When I was in middle school, he was in elementary school. I had to go across the street because kids were bullying him on the playground.
So when you're in school and they're teaching you about multiplication and stuff like that, what are you thinking?
That isn't easy. Once you tell him something and he gets it, and like, okay, I get it, I'm done. You don't need to keep repeating it. So that's where the school, it builds and it's a constant. So we're gonna learn this for a week. Well, he's already got it. So then that's when he starts with the, let me find something else to do, and I'm gonna go to sleep. So yeah, that's the part of the struggle, because he's got it, he's mastered it, it didn't take him long, he's got it.
Do you just sit there bored most of the time?
Yeah, mostly ball,
What do you draw?
anime characters.
Is it almost like there's medications that help him concentrate, even though he understands the stuff, but he just needs to sit still after he understands it?
That's basically what it's for, like, just to keep him for school, basically, to keep him here.
What is the thing that confuses you the most about other people?
I don't know why they don't know how to like take part things and destruct them. Like I was able to program that my iPad to my Xbox and then be able to control my Xbox with my iPad.
Do you always know what your brother's talking about?
Sometimes, and I just kind of sit there. I don't let him talk to me. I think it's interesting that he actually wants to talk to me about things.
Are you happy your sister always listens to what you have to say?
Yeah. Or like other people, they just like after a couple seconds of hearing me say something, they just hop on the phone and then walk away.
How old are you, Ryan?
10.
What's it like to be 10?
Odd. Very odd. His mind does not shut down. So he's constantly just going. It pops up. I wanna do a lot of things on the video games, but at the same time I wanna work towards what I want to do. Like I'm making money and upgrading my setup for gaming, and then I also want to get a new house, and then I also want to draw, and then I also want to take apart things, so it's really complicated.
What is it like for you and your brother to have these diagnoses that impact you so much, but people can't see it?
I feel like it stops most judgment, but then when I have a panic attack or he has a moment where he breaks down, it's like they're like, what is wrong with them?
When did you first start to know that she might have a diagnosis?
She was bored, and she was all over the place. But then she had, like, 1 minute she'd be here, and the next minute the world is coming to an end. I was like, that's not normal. But like, I kind of remember seeing it because my mom has the same diagnosis.
Bipolar?
Yep. And I was like, this is way too familiar.
What was it like when you realized that your daughter may be facing many of the same challenges you saw your mom face?
Bad. I was definitely emotional because I knew that, like, as she gets older, it's gonna be harder.
A lot of people think I'm intimidating because I just don't talk sometimes. But I hope everyone can come nice when you meet me.
When you're in a social situation and you are silent, what are you more than likely thinking?
Help me. I want to go home.
Do you love your sister?
Yeah,
Why?
she's funny.
It's hard to tell people that like, oh, I have bipolar, and then they're like, you're self-diagnosing yourself. And I can't just randomly pull out a piece of paper.
So people don't even believe you.
It sucks because I take all this medication. I go to therapy every week. And it's just like, it's kind of stressful dealing with it my whole life. And just for people to bully me and my brother for issues is sucky.
How do other parents react when you tell them that Ryan is diagnosed with autism?
The same. He doesn't like autistic. I hear that all the time. I'm trying to figure out if the word is supposed to be like on his forehead.
Do you think school's useless a lot?
Yeah.
Why?
Because 90% of the things we learned are already not really used.
So you're 10 years old now. When did you start thinking like that?
9. Yeah, 9.
School is like the hardest thing to do.
Why is school hard?
I have social anxiety. So there's a lot of people at school. And it makes me want to be like by myself.
Why do you sometimes feel shy?
Because I don't know what people are thinking. So it makes me shy.
What do you think when you hear Ryan describe some of his own social anxiety?
I'm like, he's so excited. I don't know how he has so much anxiety, but then I realized that he hides it very well.
Do a lot of people understand the obstacles you face?
No. Nah, not most people.
What do you wish people understood about you?
But I'm not a like bad person with all my problems. Like it kind of has built me as the person that I am.
When somebody finishes this video, what do you hope they learn and remember about your family?
That looks can be deceiving. And if you ever meet any family with our dynamic, just be patient with them because we're really like super cool. Just know we're gonna have we're coming with different emotions and different personalities all at once. But you'll get to love us.
Ryan, you did great in this interview. Is there anything else at all you want to say? This is your last question.
That Jules and less Wayne. Can I get on the next one? Yeah. I'm fine. We can about it. We can do that.
Thank you, everyone. I know that was a long video, but I felt like it was just too good not to see to the end. And I think it was important to see his sister's perspective too. She has bipolar disorder, because we're going to talk about neurodivergence as a whole as well a little later on.
And I see some questions. So yes, Ronnie, thank you so much for sharing the link at the end. This is not a child that is known to us personally. This is a video that we found, but that we really liked the message and how he talked about his diagnosis and the mom's perspective also. So we also wanted to just give some kind of helpful language as you're approaching this. I know also in the chat there were a lot of questions about age. So I think I'll actually talk about that now because I think that's a burning question that we hear often. And I feel like I'm going to have a not satisfying answer because my answer is going to be that there is no one right age. It really depends on a lot of factors like your child's developmental level. You know, thinking about often even really young kids will start to bring up or might ask questions. And so it can be a nice time. And we'll talk about different language you can use even really early on in a child's development. I know a parent, or I'm assuming a parent shared that they called it, that they told their child when the child was 3 years old, and call it awesometism, which I just think is so lovely. So I think that there is not a specific age or time frame. It's really thinking about kind of your child's ability to understand some of this language. The other thing we'll talk about throughout is that I think this can happen in stages. So you might start a conversation and add more information as the child gets older. But one thing in thinking about in case like your kids ask you questions about this or you're hearing about this is that as a field, we are really moving away from the terms high functioning and low functioning. And I really like this visual by a self-advocate that's really trying to shift our thinking. And that I think in the past, we thought about autism as like a line and like you either had more autism or less autism. And I think what we're really trying to think about now and understanding is that it doesn't really work that way. And that actually when we think about autism, we think about each person kind of having this unique fingerprint or unique combination of different kinds of needs that can even change in different settings, right? So a child might look, or a student might look one way in one setting that really caters to their needs, but then in a big crowded amusement park, they might have more support needs, right? And so I think this can be a helpful reframe as we talk about this and think about this, moving away from some of these terms.
Okay, so it's pretty much back-to-back videos, but this is another great one to touch on the topic of functioning labels. This is another one of our, I shouldn't say our, it's one of the self-advocates, Ask an Autistic. Amethyst, we use these videos a lot. Her channel on YouTube is great. I can link that at the end as well.
Hi everyone, I'm Amethyst and welcome to Ask an Autistic. I want a renaissance to shine a light, be the change we want. Set things right, we've been waiting so long.
I am not a fan of functioning labels, and I will explain why in this video. There are two main reasons that I do not like them, and I think that they actually are used against autistic people rather than to help us. Also, I just want to say that if you hear any background noise, I'm sorry about that. We got a new kitten, and so she might be getting into all kinds of mischief. I will introduce her to all of you at the end of this episode. Functioning labels are labels that people, usually non-autistic people in positions of authority over autistic people, place on people with autism to describe their abilities. So, for example, high functioning and low functioning. Functioning labels aren't terrible in themselves. I mean, they're just words. The problem is that functioning labels really aren't accurate. They aren't an accurate description of an autistic person's abilities. The truth is much more complex than simply high functioning or low functioning. Sadly, functioning labels are often used by non-autistic people to oppress and to silence autistic people. I've heard the term low functioning used to discredit the voices of nonverbal autistic people, as if communication through AAC or pointing to a letterboard or text to speech isn't as valid as speaking with your mouth parts, which I think is ridiculous. And on the other hand, high functioning is used to discredit autistic people too. I'm sure that many of you have heard this one before. Well, you're not like my child, you're high functioning. My child will never be like you. When functioning labels are used in this way, they're being used to silence autistic people, often because what the autistic person is saying doesn't match up with non-autistic people's view of autism and disability and what a good autistic looks like. Often that is silent and not meddling in the affairs of neurotypical people who know so much better for them than they do. Along with being used to discredit the voices and experiences of autistic people, either you're too low functioning to understand or know what you want from your life, or you're too high functioning to have a say in this discussion because you're not like my child. Functioning labels hurts autistic people because they're just inaccurate. To explain the ways that functioning labels are inaccurate, I'm going to have to go to the autism spectrum for a moment. When people know very little about autism, they usually have it in their minds that you are autistic or you're not. They might have an image of Rain Man or that kid from the TV show Touch in their heads. And then when they hear that autism is a spectrum, they start to think of it kind of as a dial. Oh, we have low functioning and then high functioning, or maybe, points on a line, very severely autistic to mildly autistic. Really, the spectrum of autism is so much more than that. To be autistic is to have differences and disabilities in many areas of your life and development and the way that you communicate and express yourself. And so when you think of autism as a spectrum, you have to think about it as a spectrum within each autistic person as well. And to add to our considerations of the autism spectrum, each autistic person, along with their individual strengths, disabilities, deficits, and differences, will also experience fluctuations in their ability to function in day-to-day life. Neurotypical people have days when they can handle more things and days that they can handle less, days when their energy is lower or they might need some time alone. With autistic people, it's the same. Our brains are not static. Our abilities and limitations are going to fluctuate and change day to day, week to week, in different situations and different environments. So an autistic person who can speak in the comfort of their own home in front of a camera with a carefully worded script and notes in front of them may not be able to speak so eloquently to a stranger or to an acquaintance, and they may not be able to speak at all in a situation where there's a lot of sensory input or many people present. Autism is a spectrum, not just for each autistic person and each of their abilities and differences and deficits, but also within each autistic person. So you really cannot categorize an autistic person as low functioning or high functioning, at least not if you want to do justice to each individual autistic person's life and experiences. Autistic people are people. We're going to have bad days and bad weeks. We may go through autistic burnout, or we may have good weeks or years. With the right support and accommodation, an autistic person can live on their own. They can drive, they can go to school. I find that it's especially harmful to put functioning labels on autistic children. Autistic children develop differently. That means that their development is going to look different than a non-autistic child. They may hit their milestones late or never. Some autistic people will never speak with their mouth parts, but they may.
I just want to pause for a second because I think there's some really good questions coming up in the chat about this. Like especially recognizing that like the medical field has not caught up to some of this ideology, right? And so I think that, you know, we wanted to highlight this in part because Nest is really trying to move away from this language. And I think also like if we're thinking about having conversations with our kids or with family members, like trying to think about kind of moving away from this terminology. I saw a really good question on the panel, you know, that says, you know, that was asking like, how do we describe our children in like these medical fields, right? Like if I'm trying to make a dentist appointment or a doctor's appointment. And I think that, you know, what we often try to do or model for the kids also is to like actually really describe what they need or don't need in that situation, right? So I think saying like, my son is autistic, he does not need any support for doctor's appointments. He does them independently, right? Or my daughter is autistic. She really benefits from having extra time to process information. So she may ask you to repeat herself, right? So trying to actually ground it in what the individual needs can sometimes be a helpful way, but I also want to name and acknowledge that it's not so straightforward. And I work at a hospital. Right. So I think that I understand that there's also sometimes we need these labels to advocate for supports. And thank you, Miranda, for sharing Different, Not Less by Chloe Hayden. She is wonderful. She has a great social media presence also for people who are interested in that as well.
To learn to read and they communicate through methods like AAC, text to speech, and sign language. There are autistic people who didn't start speaking until they were 4 or 7 or 10 years old. Autistic children have just as much capacity for growth and change and learning as non-autistic people do. It's just that the learning has to happen in a different way and that the development is going to look different. So to label an autistic child low functioning is severely limiting what society expects them to be able to do. Really, their strengths and their potential is erased. And when an autistic person is labeled high functioning, they're going to have trouble getting the accommodation that they need. And really, the two standards that people tend to go by when they're deciding if you're low functioning or high functioning are verbal speech and self-care skills. And like I said, using myself as the example, in front of a camera and with a script that I've prepared all week, yes, I can speak with my mouth parts and I can speak eloquently and get my point across. But in a social situation with people I don't know, or at the mall, or when I'm close to meltdown, I can't speak. I go nonverbal. When I was in high school and before I entered burnout, I didn't have a lot of trouble getting myself dressed and brushing my teeth and showering every day. But after going through burnout, these things are genuinely hard for me. I would not be able to live on my own, or at least not in a healthy way. I would go without meals quite a bit, and I would forget to drink water or go to the bathroom or to clean myself. Just because somebody can write a blog post on the internet or make a YouTube video or go to school doesn't mean that they're going to be able to do other things. And in the same way, being able to speak isn't indicative of ability to do all the other things that neurotypical people expect of you in our society. And so labeling an autistic person high functioning can actually impede them later on, say in post-secondary or in the workforce. Because when autistic people are labeled high functioning, their needs and the fact that they have a disability is erased. Whether it's high functioning or low functioning, functioning labels hurt autistic people. People ask me, well, then what am I supposed to say instead? I say, how about we talk about the autistic person like they're an individual and a person? So instead of saying Sally is low functioning, you could take a little bit more time and say, Sally is autistic. She is nonverbal and uses an iPad to communicate. She needs help with daily self-care skills, but with an aide accompanying her, she can do her own grocery shopping, run her own errands, and cook her own meals. And instead of saying John has high-functioning autism, you could say John is autistic, he communicates verbally, his strengths are in his organization, his attention to detail, and in the intensity of his special interest. He requires accommodation in school when it comes to handwritten assignments and he requires a quiet, safe place where he can recharge in between classes. So while it's not as simple or quick as slapping a label on somebody, there are ways that you can express what an autistic person's strengths and disabilities are. And I think that when we move away from functioning labels, which aren't just inaccurate, they're actually used against the autistic community, and towards a more holistic approach of treating autistic people as individuals whose own functioning levels may fluctuate day to day, month to month, or year to year, we can foster more understanding and a more accurate picture of what each autistic person's life and experiences look like. So those are the reasons that I and many other autistic people don't like functioning labels. I'll include some links to writings on the topic of functioning labels by autistic people in the video description. So if you feel like checking that out, please do. And as I said I would, I will now introduce you to Gigi. She is 8 weeks old.
Okay. You can introduce yourself to Gigi, I think, at another time, just for time's sake here. But those links will be shared. So if you really wanted to be introduced to Gigi, you can go ahead and do that. Michelle, do you see anything in the chat that you want to address before we move on?
I think we can keep going. So I wanted to start with a really helpful concept of neurodiversity. And this was one of those concepts I mentioned that I think can be really helpful, both when we're explaining a diagnosis to a child, but even before, even if you're at a place where you're not quite ready, or you feel like your child's not quite ready to have that conversation, I think naming this as a topic and a concept is a really powerful and helpful one. So I really like this, and many of you may have heard of this term before, but for those of you who haven't, neurodiversity is really this recognition that human brains come in many different forms. And what I love about this visual, right, is it says it's not a belief or a personal opinion or a political view or a theory, it's a fact. All of our brains, there's all sorts of variation in brain structure and neurochemistry. And so the idea here, right, is that this is a term that we can use to really capture a lot of this variation. And so neurodiversity has become a term that's used by a lot of individuals, and I think we'll show a video at the next slide, and has actually been really empowering, I think, for some individuals from an identity perspective to say, oh, I am a neurodiverse person. And so I think, this can be a helpful concept, and we'll talk about how Nest kind of tries to weave this in, just to start from a strength-based way of thinking about people's differences.
Okay, so let's get into Nest and disclosure, right? Your role here, your role from Nest. So this is the meat of it, I think. Maybe not, I don't know, but Nest and disclosure. So just some key points. School providers cannot disclose a diagnosis. We addressed that earlier. They can't disclose a diagnosis to a student or to other students. Your school social worker or guidance counselor can support, though, after a conversation, right? So if you've had that conversation with your child, let your social worker or guidance counselor at your school know, and they can help support you and your child. And then especially as students age, it's more likely that others will comment on their autism diagnosis. So the topic of disclosure will likely be an ongoing one as you introduce it to your child. And it's important to keep the communication open, as things will likely change as your child gets older.
And I also just wanted to point out that as kids get older, it's possible that they may be in like a perspective labs group or a speech group where other kids in the Nest program are starting to talk about being autistic also. So sorry, this got flipped, but this is just our term for the neurodivergent umbrella. This is in no way an exhaustive list, but really is just, again, to capture that these many different words and labels we have for brain variation can fall under this umbrella.
So I actually moved this here, Michelle. I moved here because I really wanted to make a push that we in Nest, we view neurodiversity as just differently wired brains, like Michelle keeps saying, right? It's actually one of the main visions of our program, and we want the whole city, we want everyone to know that neurodivergent brains are different, but not less. Right? We heard that term in the chat as well. Different, but not less. So our teams, the teams in your schools, the NEST teams are taught to emphasize whole class supports first, right? Because this helps to create a greater sense of true inclusion. And I put this graphic up here. It's called NEST in a nutshell. We use it a lot in our trainings, just to give you a better sense of what true inclusion is like, what our vision is for this. So we've pretty much moved away from exclusion. We're far from that, I would think. Segregation as well. And then you see that third one there. Sometimes inclusion is viewed like this. We don't want the kids with IEPs to just be placed in the class, like a gen ed classroom, and then pulled over to the side when it's time for instruction and kind of like sectioned off within the room, literally and figuratively. But that last graphic on the right, true inclusion, right? Autistic or neurodivergent students are not just placed in a classroom with general education students, but they are recognized as full contributing members to the class and the school community. So we want everything to kind of all mesh together. So ideally, when you walk into an S classroom, you wouldn't know who the special ed teacher or the general education teacher is because it's so inclusive and collaborative. And one of the ways we support neurodiversity in NEST is, like I said, using those whole class supports. So we really encourage that. And then I gave you two examples here of visuals. One, I think the one on the left, it's one of our elementary schools. It's an executive functioning support, right, for the whole class. So, I mean, everybody has a bad day, right? You come in, you're a little frazzled. It's raining, the bus was late, and you're just like out of routine, and there's just a visual up there, and you know exactly what you're supposed to do for your morning routine, right? It benefits everyone. So it doesn't just like point out the autistic kid. It doesn't point out the IEP kid. It's not targeting anybody. It's made for everyone. And the right there, I think that's a 6th grade example of a voice volume scale. That's something that we use. So again, it's for the whole class. And that's, I don't know if you can make them out on the right, but those are books that they're reading or they have read in the class. So they've kind of tied in interests as well. But again, the emphasis is on whole class, right? This is for everybody. And the visuals are used to support that executive functioning for autistic learners. In NEST, we're also really big on the classroom environment, right? So you'll see here both of these examples. The classrooms are organized, they're sensory friendly with the decor, the lighting, and you'll see, especially on the left there, I think it's a better view. The flexible seating is for everyone, right? Every single child in there can have a choice. On the right side, I think is a middle school example. It's the same concepts, and again, it's for the whole class. So we teach our practitioners at the beginning of the year and sometimes as a mid-year refresh to go in with something called a NEST environment scan. And they go in and they can see what may be overstimulating for an autistic learner, how to kind of organize, reorganize maybe, what kind of decor to use, the layout, just to ensure that our autistic learners are supported. These are two examples of community building activities. The one on the left there is from our 5th grade classroom. And I love how creative they were because that's just a tissue box that they've made into something wonderful. So the 5th grade students in that classroom can drop in topics that they'd like to bring up and discuss as a class. And they've built this into their routine. So it's like an after lunch routine. And they can have this discussion, something that they didn't get to during the day, or something they really want to get off their chests. And then on the right there, that's an example of how students and staff can leave Post-it notes to share thanks or compliments to reflect on. Again, whole class, everybody feels like they're valued. Everybody feels like they are an important piece to this classroom. No one is left out. No one is different, right? So we encourage our practitioners to foster a sense of community and have real student-led conversations so that neurodiversity is embraced. one of the other things we encourage in Nest to support neurodiversity is incorporating interests, right? So here we have 2 examples of interest-based visuals for the whole class. The one on the left is kind of like a reminder to clean up when you're done with the break area. I guess the class had a whole interest in Spider-Man. On the right there, it's a train-themed classroom. So each one of those bins corresponds to a classroom table. And we know through self-advocate input and research that interest can increase engagement and make students feel valued, right? So teachers get to know their students early on and then are able to decorate and incorporate those interests throughout their work and throughout the classroom. Okay, and one more example. We really encourage the use of break areas. That's kind of like I want to say a little bit of a set in stone for an S classroom. You have to have some sort of break space. So on the right there, you'll see that, I mean, it could be something as simple as just like one of those little teepees that you can go into. It's a place for the child to escape when they're in stress, right? When they're overwhelmed. And the one on the left, that's from one of our middle schools. That's a whole separate room. It's used for breaks or sensory needs, or I think sometimes it's used like a multi-purpose, like SDI session or other needs. But please note that all schools may not have whole rooms like this available, but any classroom, you're able to create some sort of space. It might just be a bookshelf that kind of blocks off a little nook in the corner and you can make it cozy and inviting. Again, this is available for the whole class and all students are taught the purpose and the structure of how to use this support, right? And by making these classroom procedures and adaptations to the classroom environment, we're kind of naturally creating a more welcoming space for all learners. Okay.
So one more key language point that we have been using throughout, you will have noticed that we've been using the term autistic instead of person with autism. That is really based on feedback from self-advocates. I will say, like, again, like when I was trained, like we were really trained to use person with autism, but we are really trying to shift as a Nest program. And so I just wanted to name that, like, we'll be using the term autistic person because many self-advocates have shared that they actually prefer to be referred to as autistic.
Just to note that that's not always the case. It's really preference, right?
Right.
But we are finding that it is more, it is less now. It's shifting from person with autism. That's how I was trained too. So that was a big shift for me as well.
Yes, and I worked with adolescents and kids who have strong feelings about it. I've worked with kids who say I have no feelings about it, right? And that's okay too.
Okay, before we move on, I have another video for you, but I just wanted you, I hope that you saw through those examples there from our Nest classrooms, you can see that neurodivergence is not only normalized, but it's also encouraged in our schools and our classrooms. This is another video from Dr. Stephen Shore. He was actually one of my professors in grad school. He is brilliant, amazing. He's autistic. And before we watch, I just want you to note that Dr. Shore talks about Asperger's, which is a term which is no longer used. It may have some negative connotations. So just keep that in mind as you watch.
Hi, I'm Dr. Hackey Reitman. Welcome to another episode of Exploring Different Brains. And today we're welcoming back Professor Stephen Shore, who teaches at Adelphi University, one of the most terrific autistic self-advocates in all the land. Stephen, welcome back.
It's my pleasure to be back. This is the third time I've been here, and third time is a charm.
One of the big stress factors for many is disclosure. disclosing I am autistic, or I have Asperger's, or I have ADHD. But let's talk about autism. What tips can you give us all about disclosure?
Well, there's two ways to look at disclosure. One is, how do we tell an autistic person that they're autistic in a way that's meaningful to them, that emphasizes abilities and strengths, but at the same time remains realistic about the very real challenges that autism can bring us. So that's one type of disclosure. The other type of disclosure is when you have to tell somebody else that you're autistic because there's a need for better mutual understanding, or perhaps an accommodation of some sort is needed. So let's take a look at both of those. The first, telling another person that they're autistic. I'll use an example of a child I started giving music lessons to at an age about 5.5, and he has Asperger's syndrome. His parents refused to use the word autism in the house because they just knew with enough intensive activity, we'd early interventionize the Asperger's syndrome right out. Well, we fast forward to the teenage years, and the kid's as Aspergerish as ever. And his parents asked me if I would do the deed. And I said, well, it's a dirty job and John Wayne ain't available. So I guess I gotta do it. So we started the next lesson by talking about his strengths in music, graphic design, in computers, and the challenges in penmanship and physical education. So that's the first of the four-step of this four-step approach that I use, recognizing strengths and challenges. The second step is that you start lining them up on a piece of paper. Strengths on one side, challenges on another. And let's see what we can do to find a strength to accommodate or work around a challenge. So with this student, like me, he was a penmanship disaster area. He was pretty good on the computer. So maybe he should just write all his papers using the computer. And he thought that was a pretty good idea. Now, you might notice that I don't use the word weakness, but I use challenge, because weakness is too static of a word and it has too many negative connotations. With a challenge, that suggests that this is something you can work through, around, over, accommodate for, or even make a considered decision to just ignore the challenge and go on to do something else. So, for example, I know that I'm pretty low functioning in a noisy bar. I also realized that I could wear ear protection. Maybe I could take some magnesium. I heard that can help with hearing sensitivities. I can learn more about nonverbal communication. Or I can just decide that I can lead a fulfilling and productive life without going into these establishments. So that's what I choose. Then there's the third step, which I call non-judgmental comparison. We look at other people's characteristics, and the idea is that different people have different characteristics. Nobody's better than anybody else. And we use our strengths to lead fulfilling and productive lives. Then I may throw in a couple of role models. Many people think Bill Gates is autistic, and he seemed to do okay with his computer business. And before presenting the label, which is step 4, I talk about scientists and doctors who study people's characteristics. And it happens to be that your set of characteristics line up with what is known as Asperger's syndrome. So we were 20 minutes into it. It was a very fast disclosure. We said, enough of this. Can we get back to the lesson? So we went on to the piano. A few weeks later, I asked his father, how did his son do with the disclosure? And Dad said, well, my son loves having Asperger's syndrome. So he got it. And now he understands the way he is. And he knows where his challenges are. And he can now effectively advocate for himself as needed, because we can talk about what those challenges are. So as we think about disclosing to another person, is a 3-step process for that as well. Most of us disclose, and with the disclosure, there's going to be a certain amount of advocacy as well. Otherwise, why would you bother to tell someone? So you're advocating for someone. So with advocacy comes disclosure, with disclosure comes advocacy. And most people advocate and disclose on their own without even thinking about it, just comes naturally. Suppose you're lost and you ask someone for directions, you get this whole verbal barrage of information, you're not going to remember it all. And so you ask for a moment of time so you can get something to take it down. You do take it down, and then you say, okay, thank you very much. Remember that all, and you go along your merry way. So what you did is you engaged in this 3-step process automatically. One, recognizing the challenge, which is too much information. Number 2, asking for some sort of accommodation. A bit of time to get out your iPad or if you're going to take this information down on. And then finally, you give a reason why. I'm not going to remember it all. So let's put that into a more autistic realm. And let us say I am being shown an open office or by my supervisor. And this is where I'm going to work. It's going to be a great place. It's pretty quiet for an open office, so there won't be any auditory issues. So as I look about the room, I notice that it's lit with recessed lighting fixtures hanging from the ceiling, or they're embedded in the ceiling. Well, the one thing that autism means to me is that recessed lighting fixtures and I don't get along. Being under one of those recessed lighting fixtures, for me, is probably like looking into a spotlight for most other people. So how do I address that? Well, many of you may think that this hat's a fashion statement, and certainly it's good to support your home team with the big H there whenever possible. But in reality, it's an accommodation, and here it is, the bill. So that's great. So that's how I address that issue. So back to the employment situation, being shown in an office where I'm going to work that's lit with recessed lighting fixtures. So I look about after recognizing this is going to be challenging for me, and I engage in step 2, which is the advocacy effort. Gee, I wonder if it's okay if I wear a hat. The reason why I need a hat is the disclosure. Is because these lights hurt my eyes. I must have very sensitive eyes. And if I can wear a hat while I work, that will increase my productivity for your office immeasurably. So you throw something in that's going to benefit the employer as well. So that was a very fast disclosure. It just took a sentence or 2. It was simple, and it was something that the supervisor could easily provide, which is permission to wear the hat. Doesn't even have to provide. So that's an example of self-advocacy, and then disclosure. Well, I have sensitive eyes, which is should be considered as a partial disclosure because I've just focused on the aspect of autism that's affecting the situation right now, as opposed to going full boat and talking about autism and maybe it being a distraction for the whole situation.
What is the single biggest tip that you would give a high school senior who's about to enter college, and that individual has a brain that's a little bit different, might be on the spectrum?
Well, I would, first I would tell them that it gets better in college. So if they can just hang on, when they go to college, all the bullies will fall away, and they'll find people, they'll find their own crowd. Second thing I will do is to focus on developing a greater understanding of how autism affects them in school and be able to advocate for themselves for necessary accommodations.
Well, that second part gets very hard for individuals, doesn't it? To be able to self-identify and then ask for the accommodation.
Right. However, at the university level, it's quite a structured process. And it begins with you going to the Office of Student Disability, sometimes it's called Office of Student Support or Office of Success or Access Office, whatever it is, you find that office. And that's where you start the process.
What do you feel is one of the biggest misconceptions the general public has about autism?
I would say that not wanting to socially interact is way up there. Because from what I know of autistic people I know, most of them want to interact with others, most want to socialize. But I think what has happened is they've had so many bad experiences attempting to socialize in grade school that they've just given up. And any desire has been beaten out of us. Because most of the time, attempting to socially interact is going to result in bullying and other bad things.
How can people find out more about what you do, Stephen?
Well, one way is to go to my website, which is www.drstephenshore.com.
Okay, I'm gonna stop us there. You definitely can go to drstephenshore.com for a wealth of resources. Like I said in the beginning, I will definitely put the links to these videos in the chat. And I realize now that I didn't do it on purpose, but I love that we had an elementary, a teen, and an adult advocate's perspective on this. It's pretty awesome. Okay,
So,
sorry, go ahead.
oh no, we're going to dive into some strategies. I know there were some questions in the chat, and I think Dr. Shore did a brilliant job outlining kind of like his 4-step plan and ways to break it down. And so I'm just going to talk through some general strategies, things to think about, ways to start this conversation. And again, I really want to go back to this idea that you all are the experts in your child. You all are the experts in when the time is right. And there's really no perfect way to have this conversation. And it's often many conversations. But in terms of big picture strategies, in terms of the when, and I'm thinking more about like the immediate when as opposed to the age question. But really making sure when you're having the conversation that everyone is feeling calm and ready to engage. So thinking about a time when maybe your child or the autistic individual is not like really engrossed in something they're really into, right? Where we're pulling them away to have this conversation. And that we are as the caregiver, the person delivering the information are feeling calm. Another thing to think about is to avoid discussing immediately after a challenging situation. And what I mean by this is sometimes our autistic kids might have big behaviors or maybe have a meltdown, and there might be a pull to say like, oh, well, the reason you did this behavior is because of your diagnosis. And we actually want to think about creating some distance, at least for this first conversation. I think after you've had this conversation, you can have a lot of really nice reflective conversations after challenging situations. But thinking about a time that feels like a little bit more neutral. And again, I want to say that there's no perfect time. And it is entirely possible your child's going to bring it up. We've had kids who've seen it on their IEPs and say, what's this? I've worked with kids who come home to their parents and say, am I autistic? Or like, so-and-so said they're autistic. Am I autistic too? Or I Googled this and here's what I found. And that's okay, right? And I think sometimes there feels like there's this pressure that it needs to be this big formal sit down presentation and, and actually I think if we're kind of calm and relaxed and it's part of the flow, I think it really, again, delivers that message that this is not something that's about being less than, or that's a big reveal, but that's something that's part of a child's life and that we want them to understand about themselves. And again, I think I've said this many times, but just to have it on the slide, this is not one conversation. You can have many over years and across development. I've had families I've worked with and where I, as the provider, right, like really prepare. And I'm like, I'm going to have this disclosure conversation. The child's like, okay, like, can I go play video games now? Right. And that's okay. And maybe then, 6 months later, they're coming back and saying, I thought about this, or I have questions, or I made this connection. So I think just kind of a word of reassurance and framing that this can kind of evolve over time. So the who, again, I think generally, you know, again, every child is different, but we generally recommend that this is discussions coming from parents or caregivers, although outside providers can always support. In my role as a child psychologist, I've certainly kind of led this conversation or supported feedback. But I think it's really nice that parents or caregivers are a part of that conversation, again, to really be modeling, right, that you're there for them, that you support them, and that you're kind of recognizing this neurodiversity. I think sometimes the questions that comes up for kids that are a little older is they might ask like, well, who knows? Or who should know? I have some kids who are ready to go tell everyone they know that they're autistic, which is wonderful in a lot of ways. And I think, you know, again, that's a personal discussion for the family, but sometimes we say things like, well, it might be helpful for your teacher to know so that they can best understand how you work. Or like it's helpful for your so-and-so therapist know so that he or she or they can give you specific strategies to help with some of these challenges. So again, really contextualizing that piece. Okay, so what does this look like? And I wanted to give kind of 3 bullet points to be thinking about kind of what does this conversation look like? I think starting, and Dr. Shore talked about this also, laying the groundwork by highlighting differences. Again, this is a conversation that can start really early in a child's development, right? That we're just non-judgmentally noticing that people have different strengths and challenges. And again, I think as caregivers, we can really model that in ourselves. Like, wow, I really need to write things down so I can remember them. Or, oh, you know what? Like your dad, like math always came really naturally to him, but for me, I really like reading. So again, just part of kind of the family dialogue and conversation. And then in the specific dialogue, I think you can start by saying one thing we know about brains is that everyone's brain works differently. And for kids who are younger, they might need some more concrete examples, right? So for example, like, you know, my brain needs this, dad's brain needs this. I need to wear glasses, dad doesn't, you know, or your other mom doesn't, things like that. The next step, and we'll go into more detail about this, is keeping it positive but authentic. So really trying to highlight the positives without necessarily negating or glossing over that there are areas where a child might need some more support. And then really trying to connect it to personal examples. And so I'll talk a little bit more about what each step of this can look like. So again, we talked about laying the groundwork for differences, using more concrete examples for kids who are younger, just because it's easier for them to understand. Modeling as caregivers. And again, even for those of you who've already disclosed the diagnosis to your children or to the student, this modeling is always so powerful and validating, like modeling what you need support with, modeling how you cope with different things, can kind of keep that door open to having these conversations. And then highlighting strengths in others, whenever possible, right? Highlighting and having those conversations. So how to keep it positive but authentic. So identify specific strengths your child shows related to autism. I wish we had time. I would love for everyone to share their strengths for their child because they all have such tremendous strengths. And I think for this conversation, going into it with 2 or 3 strengths related to autism that are really applicable to your child can be really helpful when you're introducing this idea. And again, I think Stephen Shore talked about this too, right? Like outlining, you know, what are some of these strengths or even writing them down for older kids. Also just being mindful of like our own nonverbals and tone in terms of keeping it positive but authentic, right? I think, you know, if we're thinking about this as a really serious conversation, which it is, it's important, but we don't want to come in, you know, like very serious and somber and this is the diagnosis you have, right? I think there's ways to keep it like really authentic to yourself and to your child's communication style. And then being open about potential areas of need and support. So again, you know, focusing instead of like weakness, Stephen Shore uses challenge. We've talked about tonight difference, right? One of the ways your brain might work differently is this, or one of the ways that you learn differently is this, or one of the things that might feel harder or feel more challenging for you is this, right? And when we look at these things together, it has a name, and that name is autism. And I see in the chat, I plan on doing some research on famous autistic people as a reference. I think that's a great idea. I also think what I've done with families in the past that has sometimes been helpful is looking within a child's interest. They're often, again, autism is very common. There are autistic people in all walks of life. And so often you can find autistic advocates who share that interest with your child. So that can be a nice place to look as well.
I just want to jump in real quick and mention that in Nest, there is a big push for a strength-based approach.
Yes.
We are looking at each of the children in the program, or we are teaching, I'm sorry, from our side, we are teaching the practitioners to look at the children in a strength-based manner, right? I mean, there are going to be deficits here and there. Not everybody is wonderful at writing and math and reading and all that stuff, but what are their strengths first? And then from those strengths, how can we utilize that to push them a little bit, push them forward in those other areas, right? And then see the children in a different light.
Yes. Yes. And so this is just a visual of common strengths in autistic people. If you're thinking about how do I start this conversation and explain autism, and I want to highlight some of the cool strengths. Again, there are many more. But just to name, honesty, I love, right? Like reframing that as a strength. Attention to detail, depth of interest. I often talk with individuals about their special interests and passions as a strength, and like how cool is it that your brain can focus so much on the things you love, or can hold so much information about the things you really care about. Many have a really good memory. Many are quite accepting of themselves. So again, the idea here, right, is we're thinking about this strengths-based approach. When you're approaching the conversation with the child, thinking about what are some examples that my child shows that might resonate with them. I saw a question about what to do with a child who's averse to recognizing their strengths, abilities, and accomplishments. I know that can be really hard. I think sometimes, kids can feel anxious when they're complimented. I think in the context of disclosing diagnosis, you can keep it a little more general for your child and say, one of the things we know about autistic brains is they can be really good at this, this, and this. The child may not hear it in the moment, but I think part of it also is we're modeling and repeating that over time. The hope is that the child will start to kind of internalize that or start to recognize that about themselves. So how to make it personal. I'm a big fan of writing a few notes ahead of time. It just helps me remember. So if that's helpful for you, or to sit down and think ahead of time, like what are the couple examples I want to give in these areas of strengths and in these areas, that align with autism. I think, again, what's important, especially for our younger kids, we don't need to go through every piece of the diagnosis. Some teens really want to sit down and go through kind of every point by point about what it means to be autistic. But when you're starting younger, it's okay to start with just these 2 or 3 points that you think are most relevant to your child and how autism is presenting for your child right now. So I know I saw in the chat earlier, there was a child who really has a lot of sensory needs. So maybe we start there, right? And connecting the sensory to the autism. And we don't have to dive into all of the many facets of autism right away. And again, thinking about some of these specific situations that might demonstrate some differences. So I think the more we can make it concrete and grounded in the child's real life experiences, the more likely they are able to connect to it or kind of understand this piece. And then I think at the end of the conversation, what I mean by offering resources, one is always letting a child know who they can go to with questions. Often it's a caregiver. I do the training for the social workers, guidance counselors in the Nest program. We talk about disclosure often. We talk about resources often. They are all ready and willing and wanting to support after you have this conversation. So letting the child know they can ask questions in those settings. They may have outside providers. For some of our older kids and teens, some of them might really want to read more about autism. Maybe they want to read a book. I think that's great. I think, kind of offering without pressure. Some kids might need to process the information and might not have any questions at all, and that's okay too. The one thing I do always say to our older kids is about Google and the internet, which is really a warning for us all. There is so much out there on the internet, and just like anything, there's information about autism that is helpful and not so helpful. And I think also reminding our older kids, right, that every autistic person is different. And so that if they have questions, that they really can come to you to talk about it. And if they have questions about what they, ideally we want them to avoid Googling. That may or may not be the reality for some kids. And so, but putting that out there, because I think there's, again, it's often something that comes up. Oh, I'm wondering, this is a really great question. Thank you, Melissa, about how to disclose to siblings. So I think that, again, this is really family specific, but I think these conversations, I think usually it's really helpful to have the conversation with the autistic child first, if you can. So that they know before their siblings know. I mean, I know there might be circumstances if a sibling's much older, for example, where that may not be possible. And I think like the similar features to how we disclose to an autistic child in saying, your sibling has these really, everyone's brains work differently. Your sibling has these really cool strengths in their brain. And you might have noticed that there are some ways their brain works differently than yours. And for example, like they really like to spend a lot of time on their interests, or for example, they need a little more time to prepare when there's a change coming. And I think if there's a Daniel Tiger episode or media episode, I think that's great also to incorporate. So common questions and concerns, I tried to think of some very general ones. When is the right age? I should have put this right at the beginning because this is a really common and understandable question. There's really no one right age. And again, I think about sharing in stages, right? So it may not be appropriate to sit down with a kindergartner and go through point by point, here are all the diagnostic criteria for autism, right? But we can start a conversation about similarities and differences in how our brain works. And even if you're not using the word autism, we can go back to highlighting and saying your brain, for your brain, loud noises are really hard. And so that's why we wear headphones, right? And I think Stephen Shore even mentioned that as an adult, sometimes he discloses and he doesn't say I'm autistic, he says my eyes are sensitive, right? So I think we can model that language even at a young age, even as we're building up to using the word autism. A question I get sometimes, especially disclosing to like kids and adolescents, is what if they don't agree? Like, what if I tell my child they're autistic and they say, no, I'm not? Again, I think this is a journey, and I think, we try to stay away from like really trying to get in an argument or really trying to double down and convince them like, yes, you are. This can take time. And I think what I try to do then is shift the conversation either in that moment or later back to areas of strengths and support needs, right? So even if a child is feeling like, I don't want to use the word autistic, that's not me. We can talk about neurodiversity. We can talk about really what their brain needs, right? At the end of the day, we can talk about what they need and what their strengths are, and what things might feel helpful for them. Another question I hear sometimes is, what if this becomes an excuse? And so I think sometimes caregivers are worried, well, if I tell my child they're autistic, are they going to believe that they can't do things that they otherwise would do? Or is it going to be something that they like fall back on and say, oh, I can't do this because I'm autistic? And so I think first what we really want to highlight, right? And again, from this strengths-based lens, there are many genuine reasons why certain things might be harder for your child. Or for a child, for any student, right? And so a student saying like, I'm autistic and this is hard for me could very well be a very valid thing. And I think what we try to do in Nest is not to say, okay, well, you're autistic and therefore you cannot do this thing. We never want to message that. But what we try to really support students in thinking about is, what do you need and how can we help you get there? And so I think that frame can be helpful also. And I think, again, I really encourage, if you do have this particular concern, to talk to like your Nest team, your school social worker, guidance counselor about specific situations that you might be seeing. And again, go ahead.
I was just going to read it out for you. I thought you needed a break.
I would love a break from hearing my own voice.
Sure. So this is just, it ties directly into the previous slide. What if this becomes an excuse, right? So I put the social media handle there on the bottom. When I disclose I'm autistic, it's not an excuse, it is a need to be understood. Right. And that goes back to just tying it back to Nest, right? We're all here from a Nest background. It's that neurodivergent piece of feeling valued, right? Different, not less. And that's really what we want our students to feel in the Nest program. That's what we're training our practitioners to foster in the classrooms and across the school. We want our students to feel understood.
I think another sometimes concern about disclosure is not wanting to upset a child or being worried that the individual is going to be upset by their diagnosis. And I want to honor that concern. I think, really focusing that every person's journey and kind of identifying with their diagnosis is unique. And acceptance can take time, and what autism means to your child can take time and can really vary across development. I think in the moment, if your child is upset by this news, really going back to like validation and that focusing on strengths and reminding the child that you're here for them. And again, this is a plug. You will see a repeated theme throughout these slides that your school's Nest team is really here to support. So if you have this conversation and if your child is upset, their team can also support as well. Okay, and we have some time here. So one question, have not yet disclosed and worried about my child and going around and telling other kids getting targeted or bullied. Is there helpful information you can share that we can use with our child to help them figure out when to self-disclose to other kids versus keep it private? This is a really tricky question. And there's a couple of questions about like bullying because of diagnosis. I think in terms of initial disclosure to a child, one thing I have said to kids in the past is that sometimes kids don't know what autism is or what that means. And so giving them some language to explain, like, I'm autistic and my brain works differently, or I'm autistic and that means I need X, Y, or Z thing to help me. You can also, for kids, if you're feeling like it is not safe for them to disclose in their current social environment, which we always hope is not the case, which we really strive to create an accepting environment in Nest. Visuals can also be helpful to map out for the child, like here's who knows about your diagnosis, here's who does not know, and that's okay. So I feel like that's a vague answer, and I apologize because I think it's so individual specific, but I think the things I would go back to is preparing them that others may not know what this means, giving some specific language to advocate if they don't want to use the word autism, and thinking potentially about visual supports for younger kids about kind of who knows about the diagnosis and who does not. But I think we really want to try. No, that's it. That's what I want to say. And then I also see some questions about bullying for being autistic. And I know, Ronnie, if you want to add, I mean, first of all, if there's bullying happening at school, I would definitely want the Nest school team
Absolutely
to be aware. Yeah.
That would be your first go-to, right? To get a better sense of what's going on. And I mean, we see this a lot. We see this a lot. And unfortunately, we see it a lot. And it may be a difference in perspectives where we may loop in the SDI providers too to kind of help in that way. But really, I feel like we can't give a blanket statement just because it really is on a case by case basis. But again, your first go-to is going to be your child's teachers, your principal, assistant principal, guidance counselor, social worker. They're going to be your go-to to get a better handle of what's going on. And then from there, they'll be able to better support. I'm sorry, that's such a generic answer. But I really feel like we can't give a blanket statement there.
I see a question. Are kids in the class that are not Nest kids learn about autism so it is an inclusive environment? That is a great question. I think one thing Nest is very careful to do, right, is not to single out certain kids in the classroom, right? Because again, teachers can't tell the other non-Nest kids who is autistic and who is not. But absolutely, we've been doing a lot of work with our Nest providers to educate about neurodiversity broadly, in addition to autism. And I think one thing that's really powerful that Rani really highlighted earlier is that what Nest really tries to do is just throughout the day, model all these whole class supports. And by doing that, they're modeling neurodiversity, right? They're modeling that we all learn in different ways, and that these supports can be helpful for everyone. And so I think that's how they really try to tackle an inclusive environment. And yes, many of our schools do things for Autism Awareness Month, many embed it throughout, and we're really working with our providers to also think about other areas of neurodiversity to teach about and use in lessons as well. Oh, great question, Melissa, about if there's any parent communication or connection tool for parents within the program. I believe, I mean, certainly your specific Nest school should have parent workshops where you can connect with other parents within the Nest program. I don't know, Ronnie, correct me if I'm wrong, if we have like a central Nest parent.
I don't know of one, and especially because we don't involve ourselves directly with the families aside from these. That's not something we do on our part. So that's something I would love to hear from here actually in the chat. If someone has something great to offer, that'd be wonderful. Then we can pass it on as well to other parents, other families. Marilyn, I will be sharing the links in just a minute. Oh, Katie says you are starting a WhatsApp group. That is wonderful. Okay. A lot of questions coming in. Bo says, are there still Nest workshops from different schools for all ASD parents to attend? Go ahead. I didn't question.
So these workshops are for Nest parents across all 5 boroughs. These are the ones that that NYU runs. Each school also has its own parent workshops or engagement for just the parents at that school, but we don't have, we're like, one school is hosting open to all other parents. I think these are the workshops where we have all the other parents here.
I see. Guillermo, I understand the model where NYU Nest supports a school and the school supports the teachers. What do you do when the admin is not so supportive? That's where you would you could ask to speak with someone from DOE specialized programs, right? If you really feel that's your need and you need to advocate, go ahead and move a little higher up in the chain. Thank you, Marcia. So that articulation process, that is something that our guidance counselors and social workers get into. But it's a topic that we can look into going forward. Thank you.
I hear a question that says, I've been talking to my child about his diagnosis, but did not realize it until he said he was being called names. And now this is affecting him. How do you handle that? Because now he really understands that he is different. Again, I think this is such a nuanced question. I think first I would talk to the school to really understand like what the names are, like what's happening socially and in that dynamic. And then I would really lean into this idea of brains being different but not less, and really highlighting strengths. And also thinking about ways to celebrate and highlight those positive connections also.
Jacqueline asked, does NYU offer high school or college programs for NEST students? So NEST is from K to 12. And while we don't have specific programs at NYU like college programs, I will say I'm very excited. Our May workshop, our last family workshop, is going to be presented by one of our self-advocates. And she currently is taking courses at NYU, and she graduated from a NEST high school.
And I see a comment from Maria about sibling dynamics, and I realize we didn't touch on that as much, but there are, you know, it can be a journey for siblings to accept also, I think, especially when their brains are growing and developing themselves. And there are sibling support groups. Sib Shops does workshops for siblings. I know NYU does webinars to support siblings. NYU, sorry, Child Study Center. So I think I just wanted to put that out there as well. And thank you for sharing that observation. So I think we can go ahead and put the link in the chat.
Yep. Give me 1 second. My screen is getting a little funny. Give me 1 sec. Okay, first I want to put in this evaluation link. Like I said, we look at each and every one of them, and we really value your input. This is how we plan moving forward on what to present on, what would be most helpful for you. And then this is the link to the first video. Oops. Not working. Give me a second, please.
When somebody meets you for the
Oops. Okay. Technical difficulties on the video links. I will be sure to, just for the sake of time, instead of me trying to figure this out while you're all on screen, I will make sure that we can get these to you, the links to the videos that we have 3 videos today that we've shown. We can get that to you in a follow-up. Okay. Unless you're willing to wait, and then I can do that. I can figure it out.
first time.
I'm putting the videos in the chat.
Oh, you got it?
Yeah. I don't know how. Usually technology doesn't work for me, but
we switched places today. Thank you. Thank you so much, everyone. I know we went a little bit over, but I think this is some really great information, and I'm glad we're already getting some good feedback.